come together. We want to start over?
No, go ahead. Talk to me about that flag football.
Yeah, so we had three teams this season, and we prioritize our athletes who were in season in their sport, right? So right now it's mostly baseball, softball, right? And what we did was we provided the flexibility for our parents. And in the process of that, it put less pressure on our parents to like have to want to show up or like they felt guilty of missing. That wasn't happening. What was happening though was there was consistency when they did come in. We knew that what we were teaching on Monday, Wednesday, we were gonna reinforce on the other 2 days, Tuesday, Thursday. So by having that flexibility, it provided, and also too a system in place. It provided us that consistent progression throughout the season, where our athletes were still learning, we're still competing, and ultimately had a really enjoyable experience doing it. Um, in that process too, what I learned was if there's a system in place where your coaches are also coaching, right, and there's a framework, it can become successful, right? The other part that was very important too was parents had to buy in, right? And it wasn't that difficult because most of our parents were referred by somebody else to join our team. But the consistency of our parents, right? Like showing up, trusting the process, trusting that everything was going to work out. The only time we did come together was during game day, during warmups. So, hey, you know what? This is you're playing this position, you're playing this position, and we're going to run. During our practice sessions, we also had like our structure, right? The structure was, we did a lot of our dynamic warm-ups, our movement preps, our team agilities, but we really emphasize movement literacy. So, and it's for all three divisions, right? So we have from third to eighth graders working out, but they all worked out at the same time. And I think what was really cool too was our little ones, or our third and fourth graders, were looking up to the seventh and eighth graders. The seventh and eighth graders, little, they started to really set the standard, right? So the way they practiced, the way they showed up, even whenever they did show up because they were playing other sports, they started balling out, and then they kind of pushed the little ones to ball out and compete against them. So I thought it was really interesting that happened, and it's something that we plan on doing again this summer. Right, summer is going into travel baseball and softball tournaments, but the thought is how do we make it work, and we'll figure it out. So we're going to retest it again, having a system in place and making sure our parents buy in and trust the process. So
Yeah, I think
it
that's a
was
good.
really interesting.
It seems like a good way to do things because now you're not like, oh, I have to play softball here or I can play softball year round. I can kind of sprinkle this in. And I think
Hmm.
maybe when they work with someone like you, they're doing stuff they may not be getting to, right? So how do you make it sport specific, but also give them some of the movement literacy skills that they may not get from doing X sport?
Yeah, is that your question?
Yeah, yeah, yeah.
Yeah, so I've been working as in coaching since 2005, right? And one of the things that I've noticed while coaching is, especially nowadays, because there is early specialization in a single sport, is to have variability during practice, right? Is okay, I know that this athlete is in baseball and softball. What are they not getting in those sports enough, right? So we emphasize that in our practice session so that we can essentially try to balance out as much as we can,
Yeah.
and try to bridge any gaps that they're not getting. And by doing that, yeah, they become better baseball softball players, but they're also becoming more effective flag football athletes,
Right.
right? So just having that variability uh, to be able to, um, you know, uh, essentially having that exposure for them, it really paid dividends. So I think that's important, right? Like if I'm not against like specialization of sport, if there is, uh, I'm not against it if there's like a multiple or like multi-directional training in their practice,
Right.
in their
Right.
practices, right? So like okay, so like back when you and I were growing up, we had I mean, we had tackle football, but there was already athletes who were specializing,
Right.
but there were multi-sport athletes specializing in one, right? So like we saw mostly that. So we saw like, I'm just going to talk about football. Our football players, like our DBs, for example, they had football. Most likely they had basketball. And then thirdly, they had track and field, right? Some would probably play baseball. But if we had our linebackers, offensive linemen, defensive linemen, they were football, they were wrestling, and then baseball or track and field, right? So that's what we saw back then. So I'm not against like sport specialization, but I think we need to work on being single sport athletes, but still having the exposure of multi sport in that picture.
Yeah.
So that's kind of like my philosophy.
No, I like that. I think this is what like someone like you is very important. Like for me, I kind of teach them that like, hey, I'm gonna make you like a better mover as a human, make you a better
Hmm.
athlete, and then the other stuff will transfer to your sport, right? Have you heard of the concept?
Absolutely.
Have you heard of the concept called donor sports? So it's like
Uh, Tell me more about it.
the that's the sport you do donates into that sport, meaning that
Got it.
like
Right.
parkour is one of them, and I think gymnastics is the other one. So if I just get you to do gymnastics and or parkour, you'll probably get better at whatever sport you're playing. So for me, ever
Mm,
since I learned that concept, it's like we just try to do like gymnastic movements, like the animal-based movements. Some of the stuff you do with DNS with crawling, I think,
right.
we see like skipping and karaoke a lot and say, oh, that they're probably pretty athletic. But if you can't crawl, you can kind of even see from crawling. These guys can't coordinate, the cross crawl pattern. They may not be able to run well too.
Yeah, that's a very important area to emphasize is the crawl. I think it's something that's an area that gets overlooked a lot, especially with our athletes who are having lower extremity injuries. I had this conversation with a colleague of mine is that we are like like on the clinical side when working with clients, we're working with patients, is we're still like very reactive, right? Like chiropractic's very reactive, physical therapy, and the list goes on, right? So it's how do we become more proactive, right? How do we reduce these risks of injury? And the foundation's still there. It's movement literacy, and we don't really emphasize that enough. So something like a cross crawl pattern, right? Skipping, right? Reverse skipping, lateral skipping,
Yeah.
before transitioning into something like the karaoke, So, um, there's a little tangent, but our athletes do a very, very good job of doing the karaoke. It's something that I feel like we overlook a lot, even as athletes, where we're going through warm ups, we're kind of like just going through the motions, hey, karaoke. But if we were more intentional about it, man, you can become a better mover. So that's awesome that you're really you're really on that part.
Yeah, you mentioned something earlier about like the framework. It kind of reminds me of like having a template, right? Like some of it sometimes
Mhm.
like you could be writing a workout real quick, but they don't realize that Edgar has a template in his head where like it's a power, it's maybe a mobility, and then you have like a squat pattern and like a pull pattern planned, right? So it's like do you do that still? You kind of have like a template for things and you kind of just plug in things here and there based on who you're working with.
Yeah, so like I do because I also understand that there's athletes who are in season, but they may be guest playing with someone else, and I don't even know until they show up,
Right.
right? So sometimes, when I talk to my parents, is I really encourage them, do me a favor, just communicate to me if they're really, really sore from having 5 games this past weekend,
Right.
right? Because then I need to adjust and modify the workout. So what helps me is having that framework, right? Having a push pull, hip dominant, knee dominant, and then make it bilateral, unilateral, depends on what you're working on. And also really take you know, um, the emphasis of, where are they in their season, right? Is it their primary in season, like right now, baseball and softball hasn't even started yet. It's not even about high school. We're about to get started in about, late May, early June. That's when it really starts to take off. So we really have to think about the neurological component. What is going on with their nervous system? Are they fatigued? Are they showing signs of fatigue? So there needs to be a template in place, just as something you can fall back on and modify at the moment. So, and there's other variables too within that within that template, but it's very, very important to have a template.
Yeah. So you said you have like third graders to eighth graders. What are some
Mhm.
things you've seen when you've seen a good athlete that they did in the past, and you're like, oh my God, they were a dancer. This is why they're so good at football. Like, what are some things you've seen them did before that makes them good at their sport now?
Oh man, the two main sports that I would say that I like where I have the best movers, gymnastics and soccer.
Yeah.
Those two sports by far have proven if an athlete starts there, they're most likely going to be better movers when they get a little bit older because they have the foundation to build on that movement literacy, right? So uh, a lot of times when I work with my older athletes who maybe they skipped crawling because they became a fast walker, right? We have to go back to balance. We have to go back to expose them to you know different positions of stability to create that awareness you know um, and soccer. Then we're talking about coordination, right? It's not just you know like we talk about coordination, like what coordination are we talking about when playing soccer?
Right.
Because yes, it is a an eye foot coordination or foot to ball coordination. But there's also other variables to coordination that like we're talking about rhythm and timing. Like let's get very, very specific there. Rhythm and timing and foot position, body awareness, spatial awareness, and the list goes on.
So, okay. So let's say you have some parents who maybe not have played sports, they're maybe not athletic, but they want their kid to be athletic. What age do you think you would start them? And then how would you start them? Are you going to start them with like weight training? Are you going to start them with whatever? How would you build your athlete from scratch?
Are you asking how soon or where?
Maybe how soon and where would you start?
As soon as possible. When my daughter was born, she was on tummy time right away, as quick as we could,
Right.
right? As quick as it felt we were safe. Tummy time, getting her to move. Um, but as soon as your child is able to walk, it starts then, right? With agility, the balance and coordination. If I were to prioritize one, I would probably start with balance first. Then I would go to coordination. Then I would go with agility. Then I would go with, you know, um, strength and then speed. And then we can get to other variables later. But I think that's probably like in that order for me, I would probably go with balance, coordination, and then agility.
I like that. It seems like it's cool stuff. And yeah, I mean, like you said, you're not. It's good that you're not against specialization. I think it's important, but it's also like how you do that is also important too, right?
Yeah, absolutely.
Cool, man. You got your next spot or what?
Yeah, I have a meeting with a volleyball coach right now. We're going to discuss some of the programming that we have for them during the summer.
Mhm.
All of our training is under clinical supervision. So we have the vault performance,
Okay.
force decks, et
Yeah.
cetera. But we also have the OVR system as well. And I like having the OVR system because it helps us with the in training session metrics. We can
Right.
get it right now. Vault's a little bit different because it's a whole different setup, but it also gives us that clinical perspective.
You can see the left
Um,
right discrepancies with the force plates, right? Like, they're
correct.
only
Yeah.
jumping off their left foot, even though it's a bilateral jump. It's only their left foot.
Yeah, and some of them say, "Hey, we've had injuries when we were little, and we've never really had rehab." Right? So then they're wondering, "Hey, why does my right knee hurt, but my left injury, I had a fracture in my left ankle when I was like 3, 4 years old. Never had any rehab after." Um, this is something that we really emphasize is, you know, um, in the medical world, we hear this a lot. They're young, they're going to be fine. But if you and I had any type of you know, academic issues in school, we would have an IEP right away, or
Right.
we'll have the tutoring. But you don't see that for rehab, right? It's like
Oh, yeah.
just let it wait, just let it wait.
Right.
It'll get better later. No, it doesn't, because I've seen
Right.
kids who had femoral fractures when they were kids, and they never had the rehab, and now they're having difficulty with having recurrent lower extremity injuries, and we haven't revisited that area. Then we go back to the crawling, we go back to the skipping, and it is they don't have that coordination down. And we
Right.
go a little bit further. Well, they had an injury, and their brain just rewired a certain way. So it's very important that we definitely intervene as quick as possible.
That I like that analogy a lot, man. Like if we were bad at math, we wouldn't say, "Oh, he'll just figure it out." Like let him be. You put an intervention, right? And I don't think we do. I've never seen that we do with athletics. Sometimes you do wait it out, and
Yeah,
you become reactive, like you said earlier. But yeah, I think it's
absolutely.
so I think so. One thing would be for you, you're going to kind of tell people to be a little more proactive now. Don't wait till you're hurt to see someone like you, right? You're kind of telling them that, like, hey, we got to do this kind of going forward and prescribe them things they can do on their own, right?
Yeah, absolutely. So sometimes we do a little bit of a lot of it comes out with education, just talking to the parents and having them understand this is what the process looks like. And these are some of the tiers that we got that we can build your athlete one step at a time. If they have an injury, we also encourage them. We have to revisit these areas to restore some of these neurological patterns that our body's normally wired with. However, sometimes when there's injury, it may get altered and it may look a certain way. If we don't pay attention to it now, we may see it a little bit later.
Cool. I appreciate that, man. Well, get to your meeting, man. We'll do this again and talk a little more deeper next time.
All right, sounds good, brother.
All right,
Appreciate it.
man.
All right, peace.